Hey everybody, it's Dr. Chris. I wanted to share with you today the 3 best exercises for the average lower back. These are exercises that, when everything is going well and you're healthy, are things that you should do consistently to keep things healthy. Now, obviously if you're having a problem, I wouldn't start to exercise at that point. If you're having a problem, come talk with me. We'll figure out what the problem is. Exercise might be something that's appropriate, but it might be exactly the wrong thing to be doing at that time, especially with stretching. A lot of times when people have tightness that's protective and the body's doing that on purpose, people feel like they need to stretch that away, and that might be the absolute worst thing you can do at that point. So this is for, again, the healthy lower back. When things are going well, here are the things you can do to keep them healthy, to keep the low back healthy. Number 1, plain old walking. When you walk, there is a bouncing motion that happens within the spine, and that spring or that bounce pulls fluid into the joints and pushes fluid out of the joints. And that fluid transfer is what brings oxygen and nutrients and all the things that are carried in the blood into the joints of the spine and gets rid of inflammation and metabolized old blood and things that are waste products at that point that need to get out of there. So walking is overall probably the best thing that you can do, especially when you do it for 15, 20 minutes at a time. And that bouncing action can clear the toxic junk that builds up in the joints and bring in the new fluid and oxygen and nutrients and all the things that a healthy joint needs. So walking would be number 1. Number 2, we're going to talk about a really basic flexibility move, a stretch that you can do. And that is simply to lay on your back. And when we're laying on your back, one leg will be out straight. The other leg we're going to grab onto with our hands, and we're going to pull that knee up to the shoulder on the same side, so right knee to right shoulder. But then what we're going to do is we're going to pull that knee up. We're going to take a nice deep breath, let it out. As we let it out, we want to pull a little bit further. Deep breath again, let it out. We're going to do that 3 times and then relax. Next time we bring that up, we're going to pull it towards the opposite shoulder, so right knee to left shoulder. Again, deep breath. As we let it out, we want to pull a little further. Deep breath. And pull a little further so that we have a rotational component to that stretch. That would be number 2. And of course, we're going to do that with both legs. Do that 3 breaths, 2 to 3 times each leg. Then we have a strengthening and coordination exercise. What we're going to do with this exercise, we're going to get up onto our hands and knees. We're going to take opposite arm and leg. So in this case, right arm and left leg. We're going to bring them up into the air as far as we can. Come to a stop. Back down, touch underneath. Right back up on that same side. Each time my arm goes up, my head goes up with it. We do about 10, 15, maybe 20, depending on your fitness. And then we switch sides. And we do the exact same thing on the other side. Now, once again, that's for a healthy lower back to proactively keep it healthy. It's not something that's going to leave you all sweaty. It doesn't take an hour to do. But if you do it consistently, those are 3 great proactive things that you can do to keep your spine healthy.